Hey guys, Dr. Jake Tucker here with some more spinal subluxation research, and this is an oldie but a goodie. It comes from Clinical Biomechanics in 1987, and what they found is that when a joint was immobilized after a surgery, a hip replacement surgery specifically, that what they found is there were permanent degenerative changes within 10 to 15 days. And what that means for you, regardless of whether you're dealing with hip replacement or just degenerative arthritis, is that any joint in your body, when it's out of alignment or immobilized, it begins this process of degeneration immediately. What we see is that within 14 days, permanent degenerative changes happen when a joint does not have proper alignment or proper motion. So that can be text neck, that can be working on the cell phone or the computer or driving too much to work. But ultimately, once that's out of alignment, it takes about 10 to 14 years to go from phase 1 to phase 2, where we start to see a loss of disc height, we start to see bone spurs, we start to see those degenerative changes happening because of something called Wolff's Law. And that just means that it's been immobilized, that it's not working properly, that it's not in the proper alignment, and that within 10 to 14 more years, we start seeing bone on bone, and we start seeing those bone spurs growing forward and backward, which is not as big of a deal when it's your knee or your hip, but when that's in the spine, that starts growing into the spinal canal, pinching off the nerve roots in the spinal cord, and that's not something that we like. So the sooner we catch, the sooner we find that it's out of alignment, the more we can do about it. So what are the main things that you do about it? Number 1, get some motion in there. Number 2, get the joint back in alignment. And number 3, start to reduce that inflammation. Chiropractors are fantastic at this. If you need more help professionally, then go to my website, goodlifefamilychiropractic.com, and you can find out more information there.